Hi everyone, it's Julie Traeger. Welcome back to Small Bites. If you feel tired, worn out, run down pretty much all the time, this blog is for you because we're going to be talking about adrenal fatigue. And adrenal fatigue is really just a collection of symptoms that occur when your adrenals have been so exhausted or fatigued that they're no longer functioning at a normal level. And this is a condition that's really underdiagnosed in the medical community for two reasons. One is that people who have adrenal fatigue actually look and act relatively normally. And that's because they've learned to sort of compensate because the biggest symptom is fatigue, and they just sort of push through it, and they use mainly caffeine to sort of medicate themselves for it. And then also because there is no pill, there is no surgery that a physician can give you to fix it. So honestly, because they can't fix it readily, they're not really looking for it. So let's see if you have adrenal fatigue. Let's take a little quiz. So do you feel tired for no reason? Do you have trouble getting up in the morning even when you've had a pretty good night's sleep? Do you feel constantly run down, overwhelmed? Do you have difficulty bouncing back from an illness or stress? In other words, do like colds and things sort of hang on for you a lot longer than they do for other people? Do you crave salty or sweet snacks? Do you have trouble making it through the day without caffeine? And then do you feel more awake at night than you do when you get out of bed in the morning? So if you have at least two of the above, you're probably suffering from some adrenal fatigue. So what causes it? Major causes, unfortunately, poor diet is one of the biggest ones. Gluten, processed foods of any kind, and sugary foods and drinks are really the biggest culprits. Environmental toxins, so chemicals that you find in everyday things like cleaning products, dry cleaning fluid, any of the cleaning products you use in your home, and also toxins in food are a big cause. If you've had a major illness that's taken you a while to get over, that can be a cause. Electromagnetic radiation, they're actually doing some studies now that indicate that cell phone use is really factoring in a big way to adrenal fatigue. Overconsumption of caffeine, which is tricky because caffeine is both a cause and is also a self-treatment for adrenal fatigue. And then sleep deprivation, another huge one. If you've gone with less than 8 hours of sleep for a long time, that's a biggie. And then those everyday stresses from bad relationships that like bad relationships, bad jobs, any situation where you really feel like trapped and stressed all the time, that's a huge one as well. So you can get tested, and I would recommend testing because the signs and symptoms of adrenal fatigue really mimic other more serious diseases. You can ask your physician to test your cortisol level, but there are some things I want you to know about cortisol level testing. So first, a lot of physicians will tend to draw a blood cortisol level. And that's actually not the best way to diagnose. A better way is testing of saliva testing for cortisol. And a lot of physicians will tend to just draw one cortisol level mid-morning, but that's actually not so good either. They really need to draw 4 cortisol levels all in the same day at different periods of time throughout the day to really tell what your cortisol is doing. And then there's another test that's actually quite helpful as well, and that's an ACTH test. So the way you do this is you draw a baseline cortisol level. Again, saliva is the best way. Then they give you an injection of ACTH, which is adrenal corticotrophic hormone. That's, like I said, injected. And then finally, your cortisol level is redrawn after that injection. And what the ACTH does is it actually mimics a stressor on your adrenals. So then your doctor can actually see your adrenals respond to stress. And if you've got a really good spike in cortisol after the ACTH, that probably means your adrenals are in pretty good shape. But if you don't have such a good spike in cortisol, or if your cortisol level is pretty low, you likely have adrenal fatigue and insufficiency. So if this is you, and if you're doctor can't give you a prescription to fix it, then what do you do? And so here are some steps that you can take. And my advice is going to be to work on one thing at a time, one or two things at a time, because you can really sort of send your body into tailspin, especially with the types of foods that I'm going to tell you to eliminate or reduce if you work on too much at once. So work on one thing at a time and be patient. Your body took decades probably to get here, so you're going to have to give it time because it's going to take time to heal. So here are the things to do to fix it. Severely reduce or eliminate your intake of white flour, sugary foods and drinks, trans fats, which are those fats that are in processed foods, and artificial sweeteners like aspartame, Splenda, and caffeine. And like I said, caffeine is tricky because a lot of people now, overconsumption of caffeine may have actually caused your adrenal fatigue, but now you actually need and use caffeine to get yourself through the day. So go slow on withdrawing caffeine, reduce your caffeine by a third and then a third again, and then go down to no caffeine, and do that over a period of weeks so that it's not so hard on your body. Second thing to do is to get rid of some stress. So are you super demanding of yourself and are trying to be too perfect? My strong advice would be to let some of that go. Are there things you can do to delegate, or can you pay someone else to do some things for you? Can you move into a different job, or even change jobs altogether, change companies altogether if you're really unhappy at your work? Is there a friendship you need to dump, or a relationship you need to dump? I'd seriously look at those things, and I'll tell you more about the what can happen if you don't fix adrenal fatigue in a minute. So manage your stress. Not only get rid of stress, but manage stress. And there are lots of resources online to manage stress, but take up yoga, take up meditation. And meditation doesn't actually have to be very complicated. Do a daily 30-minute walk, do some deep breathing exercises. There are lots and lots of things you can do. So get online, start looking at stress reduction techniques, and start practicing some of them. And here's one I cannot stress enough. Other than food, this is really the most important thing you can do, and that is get enough sleep. Other than the safety of an older parent or a child, there are really very few things in life that are more important than getting enough sleep. So I really stress to you, reprioritize your life if you're not getting enough sleep, and make that a bigger priority. And then there are some supplements you can take. There are a few in particular that can actually regulate cortisol levels. One of those is rhodiola, spelled Rhodiola. And the other is ashwagandha, and that's spelled Ashwaganda. So those two supplements can actually help regulate cortisol. So if your cortisol level is low, which can happen in adrenal fatigue, then it can bring your cortisol levels up. If your cortisol levels are high, it can actually help bring them down. And then there are two supplements that I just recommend pretty much everybody take, and that's vitamin C, and take more than the daily recommended amount. For example, I actually take 1,000 milligrams in the morning and 1,000 milligrams at night. And then a high-grade, medical-grade fish oil capsule. I take fish oil every day as well, and those two things really I just recommend everybody take all of the time. So it's a lot. It's a lot to fix adrenal fatigue, and it takes a long time. I have a lot of people actually tell me that they don't really want to do the work of fixing it because it's going to be pretty challenging, and they know it. And they just, their sort of theory is, well, I don't really feel that bad, so I'd just rather suffer than fix it. So let me give you a little bit of additional motivation. Studies suggest that there is a huge link between adrenal fatigue and the development of some other pretty serious diseases. Cancer, allergies, diabetes, and autoimmune disease for the biggest ones. So honestly, if you aren't sick now, you have a pretty good chance of becoming sick in the future if you stay this course. And I will also say that because your adrenal fatigue has crept up over months and years and sometimes decades, you honestly have no idea how bad you really feel. And conversely, you have no idea how much better you could feel, how good and amazing you could feel if you actually take steps to fix this. This literally, fixing adrenal fatigue could literally change your life. I am not being melodramatic about this. So that's all I'm going to say on adrenal fatigue. But don't forget that my early bird registration ends on Monday for the webinars for my webinar series, and we're going to be talking a lot more about fatigue and exhaustion and how to fix it. So if you need more support in this area, I would strongly encourage you to register for the webinar, and you can find a link to register in this email. So that's all for now. Have a really great week. Take care of yourself. I'll see you next time.